My name is Robyn. I am a community health nurse in the Northwest Territories. I work in a small community of 800 people just south of Inuvik in the Beaufort Delta region of the Northwest Territories. So we're just above the Arctic Circle on the border with the Yukon. I've been doing this for about a year in a job share position, so I fly in and out every 6 to 8 weeks for work. It's been the most challenging and rewarding year of my life. I've seen and done a lot more than I ever could have imagined, and hope to do a lot more. My previous background, I had done some work in Nunavut prior to that, in a small hospital, which is a very, very, very different nursing job altogether. And prior to that, I worked at the Janeway for a few years here in Newfoundland. So in the community that I work, there's 800 people, and for every 200 people, they provide one nurse in the nursing station. Our staff consists of a community health representative, which is often a local person. We have a few people that do home care, and then 3 community health nurses that work alongside of her. In the Northwest Territories, specifically in communities, there's a huge focus on public health. We do public health clinics every day in the afternoon, sick clinics in the mornings, and we're on call 24/7. We're always open for emergencies. So what tends to happen in the run of a day is Monday is prenatal day. Tuesday is adult health, so that would be like well man, well woman checks, prostate exams, pap tests, breast exams. You would do your routine chest x-rays for people who have a history of TB or suspected TB, an EKG for anyone over 40 who maybe hasn't had a baseline or should have one done yearly or has a history of heart disease. You'd also do like yearly blood works, vision tests, hearing tests, basically like a full run through. We do well child clinic, and that includes immunizations, developmental screening, kindergarten screening. We also do chronic care programs. Those are the biggest and most time consuming. We have an expanded scope of practice there. So we can prescribe certain medications and dispense certain medications. Some things we can only give one dose of. So there is no doctor in the community. We do contact whoever's on call in Inuvik whenever we need something. So often if you have an emergency, you either have the doctor on speakerphone and as many nurses as you can get into that room. Sometimes if you need to, you have to call in other people that work in the health center that aren't nurses. It's challenging being a white person going into a place where people are predominantly from a completely different ethnic background. Some people are socialized to having a Caucasian nurse very well, but I don't know if it's necessarily the fact that we're Caucasian or some of us are Caucasian, because actually my nurse in charge is Gwich'in. She's from that community. But I don't know if it's the fact that I'm of a different race or that they're very hesitant to trust new people coming into the community, because there's so many nurses coming in and out of the community all the time. And so right now we've established like consistent staff to look after this place, but it takes a while to get your foot in the door and for people to understand that you're there to stay and that you're there to help them and that you're not just coming and going. Because they get tired of telling their story over and over again to different people. Like they want help for this. They might have this one problem for many years, and when they have to come in and answer the same questions over and over again, and when you're the first line of contact that they're having with the healthcare system and you're triaging and you're trying to find a diagnosis on your own, you're going to ask every question in the book. And sometimes after you get so much experience, you kind of understand by association what's going on with somebody, but it's very time consuming for both the patient and the nurse, and I can see why patients would get frustrated with that. So sometimes it's not always the most welcome environment, but sometimes people are so happy to have you there and they're so excited to like teach you about their culture. Like there's no end really to the kind of stuff that you deal with, but you can make a huge difference in whatever you're doing, as long as you put yourself into it and it's a genuine interest of yours, and your interest is in making the life of the patient improved in some way, shape, or form.